So, levodopa is a dopamine precursor which is used in treatment of idiopathic Parkinsonism. Dopamine is available as a medicine, but we cannot use it for treatment of Parkinsonism because it does not cross the blood-brain barrier. So, we are using the closest precursor of dopamine, levodopa, for treatment of idiopathic Parkinsonism. So, levodopa crosses the blood-brain barrier and it is converted to dopamine in presence of dopa decarboxylase. And this dopamine will interact with the D2 receptors in the basal ganglion and relieve the symptoms of Parkinsonism, rigidity, tremors, and all that. And levodopa also in the peripheral tissues will be broken down to dopamine in presence of peripheral dopa decarboxylase. And this dopamine will act on the D2 receptors in the chemoreceptor trigger zone and cause nausea and vomiting. It also has its effect on the CVS, resulting in tachycardia, palpitations, and postural hypotension. So, only about 2 to 3% is available for the basal ganglia, and the rest of it remains in the peripheral tissue. So, in order to increase the bioavailability of levodopa in the brain or in the basal ganglia, we're using carbidopa and benzerazide along with levodopa. So this is going to inhibit the peripheral dopa decarboxylase. We will have greater amount of levodopa crossing the blood-brain barrier.